To diagnose bipolar disorder, the therapist may use many tools, including a physical exam, a thorough medical history, which will include asking about your symptoms, lifetime history, experiences and family history. Medical tests, such as blood tests, to rule out other conditions that could be causing your symptoms, such as hypothyroidism. 4. A mental health evaluation. Counselor may perform the evaluation, or they may refer you to a mental health specialist, such as a psychologist or psychiatrist. People with bipolar disorder are more likely to also have the following mental health conditions: anxiety, attention deficit, hyperactivity disorder, ADHD, post-traumatic stress disorder, PTSD, substance use disorders, dual diagnosis. Because of this, as well as the fact that memory is often impaired during mania so people can't remember experiencing it, it can be difficult for healthcare providers to properly diagnose people with bipolar disorder. An effective treatment plan usually includes a combination of the following therapies: medications, self-management strategies, like education and identifying the early symptoms of an episode or possible triggers of episodes. 4. Helpful lifestyle habits, such as exercise, yoga and meditation. These can support, but not replace, treatment. Other therapies, such as electroconvulsive therapy, (ECT), in cases that are poorly responsive to medication or where rapid control of symptoms is necessary to prevent harm. Bipolar disorder is a lifelong condition, so treatment is a lifelong commitment. It can sometimes take several months to years before you and your healthcare provider find a comprehensive treatment plan that works best for you. Although this can be discouraging, it's important to continue treatment. Episodes of mania and depression typically come back over time. Between episodes, many people with bipolar disorder don't have mood changes, but some people may have lingering symptoms. Long-term, continuous treatment can help manage these symptoms. If you have other mental health conditions in addition to bipolar disorder, such as anxiety or ADHD, it can be more difficult to treat the conditions. For example, the antidepressants healthcare providers prescribe to treat obsessive-compulsive disorder, OCD, and the stimulants they prescribe to treat ADHD may worsen symptoms of bipolar disorder and may even trigger a manic episode. What types of therapy are used to treat bipolar disorder? Psychotherapy, also called talk therapy, can be an effective part of the treatment plan for people with bipolar disorder. Psychotherapy is a term for a variety of treatment techniques that aim to help you identify and change troubling emotions, thoughts and behaviors. Working with a mental health professional, such as a psychologist or psychiatrist, can provide support, education and guidance to you and your family. Different types of therapy for bipolar disorder include: 1. Psychoeducation. Psychoeducation is the way mental health professionals teach people about their mental health conditions. As bipolar disorder is a complex condition, learning about the condition and how it can affect your life can help you and your loved ones manage and cope with it better. 2. Interpersonal and social rhythm therapy, IPSRT. This therapy is designed to help you improve your moods by understanding and working with your biological and social rhythms. It emphasizes techniques to improve medication adherence, taking your medication regularly, manage stressful life events and reduce disruptions in social rhythms, day-to-day differences in habitual behaviors. IPSRT teaches you skills that let you protect yourself against the development of future manic or depressive episodes. 3. Family-focused therapy. This therapy is for adults and children with bipolar disorder and their caregivers. During this treatment, your loved ones will join you in therapy sessions of psychoeducation regarding bipolar disorder, communication improvement training and problem-solving skills training. 4. Cognitive behavioral therapy, CBT. This is a structured, goal-oriented type of therapy. Your therapist or psychologist helps you take a close look at your thoughts and emotions. You'll come to understand how your thoughts affect your actions. Through CBT, you can unlearn negative thoughts and behaviors and learn to adopt healthier thinking patterns and habits. What medications are used to treat bipolar disorder? Certain medications can help manage symptoms of bipolar disorder. Generally prescribed to treat bipolar disorder include: 1. Mood stabilizers. 2. Second generation, atypical, neuroleptics, also called antipsychotics. 3. Antidepressants. If you are taking medication for bipolar disorder, you should talk with your healthcare provider to understand the risks, side effects and benefits of the medication. Tell your therapist right away if you're experiencing concerning side effects. They may need to change your dose or try a different medication. Remember that medication for bipolar disorder must be taken consistently, as prescribed. 1. Mood stabilizers for bipolar disorder. People with bipolar disorder typically need mood stabilizing medication to manage manic or hypomanic episodes. Types of mood stabilizers and their brand names include lithium, escalate, lithabid, lithanate, valproic acid, depakine, divalproic sodium, depakote, carbamazepine, tegretol, equatro, lamotrigine, lamictal. Lithium is one of the most widely prescribed and studied medications for treating bipolar disorder. Lithium is a natural salt and will reduce symptoms of mania within 2 weeks of starting therapy, but it may take weeks to months before the manic symptoms are fully managed. Because of this, therapists often prescribe other drugs like antipsychotic drugs or antidepressant drugs to help manage symptoms. Thyroid gland and kidney problems can sometimes develop when taking lithium, so your healthcare provider will monitor the function of your thyroid and kidneys, as well as monitor the levels of lithium in your blood, as levels can easily become too high. Anything that lowers the level of sodium in your body, such as switching to a low-sodium diet, heavy sweating, fever, vomiting or diarrhea may cause a toxic buildup of lithium in your body. Be aware of these conditions and alert your doctor if you are on lithium and experience them. The following are signs of lithium toxicity, lithium overdose. Call your therapist immediately or go to the nearest emergency room if you experience blurred vision or double vision, irregular pulse, extremely fast or slow heartbeat, difficulty breathing, confusion and dizziness, severe trembling or convulsions, passing large amounts of pee, uncontrolled eye movements, unusual bruising or bleeding. 2. Neuroleptic medications for bipolar disorder. Therapists often prescribe second-generation or atypical neuroleptics, antipsychotics, in combination with a mood stabilizer for people with bipolar disorder. These medications help with both manic and depressive episodes. Only 4 of these drugs are US Food and Drug Administration, FDA, approved to help treat bipolar depression, including cariprazine, Vraylar, lurasidone, Latuda, olanzapine fluoxetine combination, Symbyax, quetiapine, Seroquel. However, other medications, such as olanzapine, Zyprexa, risperidone, Risperdal, and aripiprazole, Abilify, are commonly prescribed as well. 3. Antidepressants for bipolar disorder. Therapists sometimes prescribe antidepressant medication to treat depressive episodes in bipolar disorder, combining the antidepressant with a mood stabilizer to prevent triggering a manic episode. Antidepressants are never used as the only medication to treat bipolar disorder because only taking an antidepressant drug can trigger a manic episode. Side effects of bipolar disorder medications: drowsiness, weight gain, metabolic dysregulation, including abnormal lipid levels, dyslipidemia, high blood pressure, hypertension, and high blood sugar, hyperglycemia, aphasia, feelings of restlessness and agitation with a compelling need to move, rock or pace. Other medical treatments are used for bipolar disorder. 1. Electroconvulsive therapy, ECT. This is a procedure in which a brief application of an electric current to your brain, through your scalp, induces a seizure. It's most often used to treat people with severe depression. ECT is very safe and highly effective for medication-resistant depression or acute life-threatening mania. It's the best treatment for mania in people who are pregnant. ECT uses general anesthesia, so you'll be asleep during the procedure and won't feel any pain. 2. Transcranial magnetic stimulation, TMS. This therapy involves a short electromagnetic coil that passes an electric current into your brain. Therapists sometimes use it to treat medication-resistant depression. It's an alternative to ECT. TMS isn't painful and doesn't require general anesthesia. 3. Thyroid medications. These medications can sometimes act as mood stabilizers. Studies have shown positive results in reducing symptoms in people AFAB with hard-to-treat, rapid cycling bipolar disorder. 4. Ketamine treatment. Ketamine, an anesthetic, given at low doses through an IV, has been proven to provide short-term antidepressant and anti-suicidal effects for people with bipolar disorder.